Hi, everyone. Welcome to CSIS. Today, I'm Steve Morrison. I'm Senior Vice President here and Director of our Global Health Program. And we're really delighted to come together today to view this documentary on Ebola in America that we produced a short while back, and most importantly, to have a conversation, a very active conversation among the four very distinguished practicing journalists who are here with us today to talk about that. That includes Jackie Leiden, who I'll introduce when we come together, but who worked very assiduously with us on the production of this documentary and was one of our partners. Also includes Helene Cooper, who appears in this and who gave us quite a bit of cooperation. Ray Suarez, John Donovan have also joined us. I'll say a few more words about each of them when we begin the round table. I want to offer special thanks to Sam Ellis, who's not with us today. He's in India, but who was very instrumental in putting this entire production together. This was a bit of an experiment for us. We had been working on Ebola as it evolved overseas. We were traveling, we were writing commentaries, we were holding events here. I participated in one of the international panels, the Harvard-London School panel, that looked at the consequences, made recommendations. And in that context, it struck us that, in fact, there hadn't been adequate consideration about what had happened here at home. And many of the same people that we were engaging with that feature here, particularly in the administration, were people who were struggling with the realities at home as much as they were the realities in West Africa. And they were very cooperative. They were very open. They were remarkably receptive to talking honestly and candidly with us. Much beyond our expectations, in fact. And as we began the process of discovery, we were very encouraged by how open and insightful people were, because we were engaging them roughly a year after this. So the memories were very vivid, and some of the painful memories were vivid, but people were not defensive. They were not guarded in the way that they talked about things that didn't work, things that did work, and that was much to our benefit. This was an experiment in doing a kind of video product, a kind of long form, a commentary on an important and complicated policy matter. We thought we would take this occasion here to bite off one dimension, the media role, and focus on it and get very, very insightful journalists in the mix to help us with this. So what we're going to do today, we're going to view the documentary, and then immediately thereafter we're going to go into a roundtable discussion that'll take us up to 5 p.m. We'll be calling on you in the latter portion of that discussion to join in the conversation. I want to offer a welcome also to those online who are joining us this afternoon. We'll post this afterwards on our website. You'll be able to see that. There's a reception that follows at 5 p.m., and please, you're all welcome. We'd love to have you join us for whatever portion of that you carry on for about an hour. So with that, if we could tee up the video, and we'll get started, and then we'll begin a roundtable immediately afterwards. Thank you so much.
Ebola quietly appeared in late 2013 in a remote corner of West Africa. Ebola quietly appeared in late 2013 in a remote corner of West Africa. Though Ebola had appeared many times in other parts of Africa, this outbreak would be like no other, even reaching the United States and Europe. By mid-2014, Guinea, Sierra Leone, and Liberia were in the throes of a swiftly escalating regional crisis. Ebola's threat suddenly became starkly real for Americans when the missionary doctor, Kent Brantley, and a colleague arrived in Atlanta, the first Ebola patients to reach American shores. And as the Ebola crisis in West Africa deepened in August and September, internal debates delayed action by the Obama administration until the president announced on September 16th that he was ordering troops to West Africa, the first ever U.S. military deployment to battle a dangerous disease overseas. Fear skyrocketed when Thomas Eric Duncan, a Liberian, sparked a crisis in Dallas. Duncan became sick and died of Ebola while infecting 2 nurses. And as the fall of 2014 unfolded, Ebola turned America upside down. There were a mere 10 cases of Ebola in America in 2014, including 2 deaths and 2 secondary infections. There was a media storm, calls for quarantines and travel bans, stigma against health workers and their families, lapses in leadership, and widespread confusion. Clashes broke out over who was in charge and how best to protect Americans. This CSIS documentary examines how Ebola was experienced in America in the fall of 2014. We've drawn upon extensive work at CSIS. We've reached out to many individuals who played key roles in Washington, Dallas, Atlanta, New Jersey, and elsewhere. This is their story. We're grateful to each for their courage and leadership and for sharing with us their reflections on this extraordinary, turbulent period. Several factors drove Americans' fear and panic. Most fundamental, Ebola is a rare, highly lethal disease.
Ebola is a terrifying experience. It's terrifying and humiliating. It's painful. It causes severe headaches, body pain. It is scary to see the symptoms that you've seen in patients developing in your own body. And even those people who come to help you can't touch you. And that was one of the hardest parts of it, was the anxiety that loneliness caused.
It's also terrifying to Americans because Americans were watching these horrifying images coming from West Africa, but never expected that it was going to land on their shores. And Americans simply did not understand the basic science, that it was transmitted by exposure to contaminated body fluids, that it couldn't be transmitted by air, and it couldn't be transmitted by someone who was asymptomatic. If Americans had known more about this disease, there would not been as much runaway fear.
I think we're scared because it's scary. I mean, people aren't wrong to be scared. Ebola is a fatal disease. It was a disease we had never had in the United States before, and people weren't wrong to be scared of it.
When Craig Spencer was first diagnosed in New York City, it really came and hit home, not only because I live in New York, but I was about 8.5 months pregnant at the time. And I think probably a little bit more conscious and nervous about exposure to germs and disease than I normally would have been, but rode the subway like any other New Yorker.
We had just one case, but people were stopping their trips to Dallas, conventions were being canceled, schools were threatened to be closed. This was an unbelievable amount of fear that really I think we couldn't have predicted.
I will never forget the day that I arrived at Newark International Airport in New Jersey. And I remember my mother had actually sent me an email a couple of days before saying, "Are you afraid? There's a lot of fear right now in America about Ebola. Are you afraid to come back?"
And that's when what I call the epidemic of fear. We didn't have an epidemic of Ebola, we had an epidemic of fear in the United States.
Americans' fears escalated swiftly. Their trust and confidence dropped as major mistakes occurred and as the limits of knowledge became obvious and as official guidelines shifted.
On one hand, we had authorities saying, here's what we know about Ebola. It's not airborne. You're only at risk if you're exposed by direct contact to a person who is symptomatic and sick. And on the other hand, we were putting healthy healthcare workers in quarantine, telling them you need to stay inside your house or we're going to arrest you. Or I think society picks up on those discongruent messages and says one of you's not telling the truth.
Judge Clay Jenkins, head of Dallas County, was the designated lead coordinator of the response in Dallas.
The premise that the healthcare experts were going on when this occurred, when Ebola struck the United States, is that any hospital following their normal protocols for sanitary PPE use could handle an Ebola case without infecting a healthcare worker.
Ken Isaacs, head of operations for Samaritan's Purse, was responsible for the care of Dr. Brantley and other employees at risk.
And in one conversation with Dr. Frieden, I said, so you're telling me that if I've been to Liberia and I get a fever, you want me to go to Watauga County Hospital and tell them I might have Ebola? And he said, yes, they'll be able to handle it. And I said, doctor, I don't think this is going to work out good for you.
We erred in saying that any hospital could care for a patient with Ebola. We made that error based on the best available evidence that we had at the time.
Although there had been a lot of guidance that had been pushed out by CDC about how to limit the spread of the infection, putting that guidance into real life operations was more complicated. It was a disease that no one had really understood, and even how it was transmitted was not well understood. And so that was the big surprise to all of us, and that was the first lesson learned, that we just did not have our arms around transmission early on.
Dr. Allison Lydell headed the infectious disease team at Texas Health Presbyterian Hospital that cared for Thomas Eric Duncan.
We initially used the guidelines from the CDC, which were a certain level of personal protective equipment, and then that evolved every day. There was an escalation in the personal protective equipment, eventually ending up with the guidelines that we have for what is called high-level PPE now.
And I think what I'm told by healthcare professionals that we fail to understand and appreciate in our belief in our system is the copious amount, because you're doing IV fluids and some of the other treatments that we do in first world medicine, the copious amounts of contaminated fluids that people would be dealing with.
To be blunt, we were in a tough spot. We were still reliant on Texas Presbyterian to care for the people with Ebola. They had clearly made big mistakes early on in the care of Mr. Duncan. They had sent him home when he said he was from Liberia and had a fever of 103. If they hadn't done that, he wouldn't have been nearly as sick and nearly as infectious when he came back the second time. And the second time when he came back and they were worried about Ebola, the infection control that they did was very non-systematic. They didn't follow the CDC recommendations.
The protocols work. We have decades of experience caring for patients with Ebola, but we know that even a single lapse or breach, inadvertent, can result in infection.
Mr. Duncan at that point was terribly ill. He was having 2.5 gallons a day of diarrhea. And that amount of diarrhea with highly infectious particles is most likely what led to the 2 nurses becoming infected.
It's hard for many here to imagine. A young woman following every rule risked her life to try and save another. Nina Pham is 26 and was part of the team that treated Thomas Eric Duncan. She sought treatment early and is in stable condition.
I'm not blaming you for Ebola. Ebola is a disease that it happens to be ravaging a part of the world right now, and we're trying to stop it from coming on our shores and trying to stop it from spreading. And I realize that's your #1 mandate right now. But let's just be honest about where we are. I mean, you did make that assurance, and now we have had somebody die in the United States from Ebola, and now a nurse, a healthcare worker. So the American public looks at you and says, why should we trust you? And why should we trust the administration when Barack Obama told us we are prepared if Ebola reaches our shores and that the medical personnel would be adequately trained?
Well, it's hard for me to talk about this. Imagine having to care for your own colleague. It was pretty bad. And everyone cried all day. You can see that this still causes a lot of reaction for me.
I was at the hospital when they told Nina, and I could hear her, you know, and I could hear her parents. They were in the next room when they told them. When Amber flew, despite the fact that she was beginning to show symptoms, I was disappointed in that. And that was something that came across to the public.
We should definitely not have let the second nurse fly the second time. That's because there had already been then Nina Pham, the first nurse diagnosed, and with that, we realized that all healthcare workers needed to be considered high risk and should not have been allowed to fly. So that was a definite mistake.
CDC had the lead responsibility for communicating with the American people, and it erred early in this phase by being overconfident in our abilities to manage it. There needed to be more nuance, more realism in the descriptions of what we know and what we don't know. They were a little slow at getting to Dallas in strength. They became a magnet for people's frustrations and fears, and they had to struggle against that.
The absence of a strong, unified public health system in America was a major liability and a major cause of tension and confusion.
I think the big irony is that we have some of the most sophisticated hospitals in the world, of course, here in the United States, but we don't necessarily have the best public health system. And by that I mean a system that is extremely well networked, where you have effective systems already in place to train nurses and doctors, for example, on how you manage a suspected Ebola case. It's a very fragmented system.
CDC, by definition, has to assist from the rear. It has to help state and localities respond to these crises. But in the midst of a crisis, people want to see federal authorities jump in and do things really, really rapidly. And so helping from the rear is sometimes not so great.
Ron Klain, former chief of staff to Vice Presidents Gore and Biden, was tapped on October 17th to lead the White House efforts on Ebola.
The challenge was this: each governor had to look out for his or her own state and protect his or own people. That is their job. Well, I was the Ebola response coordinator. People called me the Ebola czar, but I wasn't very czar-like in my powers. But we live in a system of divided and separated powers in the United States. Governors don't answer to the president. They certainly don't answer to the Ebola czar.
I think within Texas, there were some challenges in communication. The public health people understood full well that in the United States, health is a state affair, and it was up to them to do the response with us in a supporting role. The state of Texas and the local area had some friction between them. And early on, before the first press conference, when Mr. Duncan was diagnosed, I spoke with the health officials and the political leaders in the jurisdiction, and I made abundantly clear, we are not in charge, you're in charge. And that's the way it works in this country. Health policy is set at a state level. And while most states followed the CDC recommendations, some didn't. And some didn't because of political posturing, or because of lack of understanding, or because they had so few individuals it affected, they thought it was just made more sense to go their own way.
The media storm, compounded by the U.S. electoral season, profoundly fueled panic and fear.
This is difficult for me to say, but I think this was not journalism's best period. I think a lot of the coverage out of the region, out of Senegal, out of Sierra Leone, Guinea, and Liberia was heroic. I thought the coverage here in the U.S. was appalling. It was so hysterical. It was so wildly spun up. After a while, I stopped turning on CNN and Fox News because I would get so angry.
Helene Cooper, a Liberian American, covered the Ebola story in both West Africa and America.
A lot of it is, I think, based in fear, and that's completely rational, and you can easily understand that. But as reporters, we're supposed to sort of parse through that, and I don't think a lot of that was being done.
Greg Gonsalves headed a Yale ACLU study of the health workers quarantined during the Ebola crisis.
We didn't see the news media act in the best interest of the country. We saw them act in the best interest of ratings and their own bottom line.
And I remember one call that I had with Kent about 10 days after he got back in the States. I called into Emory and talked to him, and I said, Kent, I got an aggregated media report this week, and your life's never going to be the same. He said, oh, I know, long-term health effects and everything. I said, no. I said, there were 1.7 billion unique visitors to articles about you. He said, billion? I said, billion.
One of my friends had texted me while I was still in Liberia, and he had said that he was getting phone calls from media, and he wanted to know how I wanted him to respond, or if I wanted him to respond. And I said, I responded to him, I'm not sure I understand. Media is calling you? And his response kind of demonstrated the humor in his mind of, like, yeah, yes, some media are calling to find out about you.
I mean, I had several national news corporations come to my front door. Of course, I wasn't there. I'm not sure what they were expecting to find. My husband politely told them I was at work, as I was for weeks.
Yeah, there was one partisan media group, Breitbart. That group filed a CPS, which is a Child Protective Service complaint against me for going home to sleep in the same house with my family. And then they had protesters at my daughter's school, and they sent emails out to various parents.
I think when I go back to the different events, first we had Ken Brantley and the other people being flown back from West Africa, and that became a massive media story with helicopters overhead and dozens of media cameras, front page of the papers, Donald Trump saying we shouldn't have let him back in, and a lot of intense attention to that episode. And frankly, that's when I began receiving quite a few death threats.
I keep the cable quad on in my office all the time. And, you know, there would be polling like, are you more afraid of Ebola or ISIS, right? And you'd have Donald Trump tweeting out. We actually did an analysis. It was that Donald Trump tweet that kind of led to this level of reaction.
The 2014 electoral season stoked the media frenzy. Keep in mind, all members of the House, a third of the Senate, many powerful governors were up for re-election, and they just dove into the deep end. As we're seeing today in 2016, the political climate in the United States was turning really ugly. There was anti-establishment anger and frustration. There was distrust of public authorities, and all of the efforts to try to communicate with the public were running up against that as well. And that was compounded by our electoral season.
As fear and pressure intensified in October, President Obama announced that returning travelers from Ebola countries would enter the United States through 5 airports, where they'd be subject to enhanced screening and assigned to one of 3 categories of risk. Only those at the very highest risk would be confined to home. In the same period, the U.S. military ordered that soldiers deployed to West Africa would undergo a 21-day mandatory quarantine. Ultimately, the overwhelming majority of travelers, over 35,000, entered the lowest risk category. They actively self-monitored and were able to live normally. 500 were of moderate risk, and they were monitored more closely. In retrospect, the system worked very well. Not a single new case of Ebola was imported into the United States. However, in October of 2014, when the system was first introduced, it didn't bring a halt to clashes between the federal government and state authorities. Quite the contrary.
New York's JFK became the first U.S. airport to introduce screening measures for passengers from Liberia, Sierra Leone, and Guinea. Helene, tell us a little bit about this process.
Well, it's I came into Dulles, and I come in to meet the press, and then I go on the show, and we're talking about Ebola, and it was, you know, the aftermath of Thomas Eric Duncan, and after the show, my boss calls me, and they're like, "What are you doing? What are you doing on TV?" And I was like, "I was on Meet the Press," and they're like, "Okay, we'll get back to you tonight. Just go home and stay there."
But the way we were going to make the American people safe from Ebola was to get people to go to West Africa and fight the disease there. And the only way you were going to get people to go to West Africa and fight the disease was tell them that they could come home after they had done that service, right? And so that meant you had to persuade governors that, in fact, they had to let people come back into their states, and that, far from making their populations less safe, was ultimately going to make their populations more safe. That's a hard sell. It's complicated. People understand the fear of someone coming back to their state with Ebola, but the benefit of sending those people is a little more abstract, a little less concrete. And so getting that across, I think, was the biggest challenge we faced in dealing with this domestically.
What we ultimately did was establish, for the first time ever, an active monitoring system so that there was a closed loop, essentially. When someone traveled and came back, we would monitor them. And if there had been a travel ban, we wouldn't have been able to do that because people would have evaded the way of traveling through official channels.
And I came back to this country right in the aftermath of the Thomas Eric Duncan case, and just got hit with this torrent of quarantine and it was this political firestorm, and and at first I was pretty surprised that things what I thought had been bad to begin with here before I went home had gotten even worse.
Meanwhile, a nurse who lives in Fort Kent, Maine, is upset about being quarantined at a hospital in Newark, New Jersey.
Giving health care to dying people in Ebola. And this grandstanding Governor Chris Christie sticks her in this completely medically unnecessary isolation chamber.
And the fact is that we're doing exactly the right thing. 6 other states have now agreed with us. The Joint Chiefs of Staff now.
Obviously, it started with just being questioned over and over again at the airport. There was a lot of chaos, not a lot of coordination, didn't seem like a lot of leadership. And quickly I found myself in the tent in New Jersey with Governor Christie sort of explaining to the population that he was going to protect them and he was going to go above and beyond the CDC protocols to protect the people of New Jersey.
My conclusion that we needed to do this to protect the public health of the people of New Jersey. Governor Cuomo agreed, and now Mayor Emanuel agrees, and I think the CDC eventually will come around to our point of view on this.
What happened in the fall of 2014 was political. It is absolutely clear to us in the analysis we did that this was grandstanding of the highest order, a bipartisan grandstanding. Little did it matter that the way to protect the public was not by using quarantines, which were basically excessive, scientifically unjustified, and constitutionally dubious.
I was scared about what he was going to do to me, about how long he was going to leave me in that tent. And that fear led me to write an op-ed for the Dallas Morning News.
Well, an excess of caution also has to be balanced against people's constitutional rights. You're supposed to use the least restrictive measures in order to protect people against infectious disease outbreaks, not the sort of neutron bomb of public policy in the use of quarantine.
I was in the tent for about 80 hours, a little over 3 days. I was finally allowed to meet with my lawyers through a plastic window of the tent on Sunday evening and released on Monday afternoon.
About 40 quarantines that we could sort of detect through sort of scanning media reports and other reports that happened across the country, about 230 unofficial quarantines. But again, there is no record. You can't go to the state public health departments and ask them, how many people do you quarantine? What are your policies on the books? Because we asked those questions and we were summarily ignored by most of the states across the country.
As public trust and confidence in the White House declined, the Obama administration struggled over what more exactly to say to the American people and what the president himself should do.
Most people just want to do the right thing. There was a strong sense of camaraderie, a mission. So we were just trying to problem solve and come up with creative ways to make sure that we wanted him to get the best care he could possibly get. We weren't willing to just put him aside and watch him. We wanted him to really get the best medical care he could, and that was our #1 priority.
I was concerned about the hospital and the people at the hospital. If you go forward to the night that Nina was diagnosed, I was about to go to sleep, and David Lakey called me on the phone and said she tested positive. I was not expecting a positive test. Our mayor, Mike Rawlings, was asleep. I woke up Mike, told him what had happened. He said, "What are you doing?" And I said, "Well, I'm putting my pants on, I'm going to the hospital." When Amber got sick, it became apparent that the people in the hot zone were actually the first, the medical providers. And I thought it was important for the leadership structure to be there in the building. The building, it was like a tomb almost. I mean, no one was there, no patients were going in. And part of the leadership of that was just telling people they were doing a good job, telling people that you were proud of them.
We were on the edge of a breaking point. We had an expectation that these white knights were going to fly in from the CDC immediately and take care of everything, and that's really not the way it happens. We're responsible for taking care of our own patients, and we had to figure it all out ourselves, and I think every hospital needs to realize that they're going to have to figure it out themselves.
There were several of us that reached out to health departments throughout this region, and in fact across the state of North Carolina, and we would go out, if a health department wanted to, or doctor's offices or a hospital or medical systems wanted to organize a meeting, we would go out and talk with them in great detail about what Ebola was, how it was spread, how it was controlled, and what kind of safety measures they needed. We would circulate the CDC handouts and try to educate medical personnel. And we found that by doing that, by giving people knowledge, it tamped down their anxiety.
In October of 2014, I was invited to the White House for some meetings, but also for a press conference that the president was holding. And they invited me to introduce the president at this press conference. He applauded healthcare workers who had joined the fight against Ebola, and he called on the public to look to these healthcare workers as heroes, as someone to be applauded, not to be feared or stigmatized. And I think the reason they asked me to introduce the president was because they felt like I was a visual representation of the message they were trying to push that day. But that message was critically important to me in October and November, when the hysteria was at its worst and the need for people to respond out of compassion, to relinquish their own right to safety for the well-being of their neighbors, for the well-being of humanity. That was a pivotal time.
For me, it was the fact that the president very quickly identified this as a national security priority, and he himself took it very seriously. He brought in DOD, State Department, as well as our medical health professionals. He insisted on a very high level of accountability and planning in response to this. And without that kind of top-down leadership, we never would have been able to mobilize the response we ultimately got to, which I think ultimately helped contain the disease in West Africa.
Well, I think what President Obama did really effectively was speak very candidly with the American people and tell them that there were risks, there were dangers, but he had a plan to deal with it. And I think that kind of candid conversation was very effective. I think he also did some things symbolically to try to reassure people. Giving a big hug to Nina Pham. She came to the White House, the president invited her into the Oval Office, hugged her. That picture went around the world, and it conveyed a message of not stigmatizing healthcare workers, but recognizing them, recognizing their heroism, and that we are comfortable with once someone is treated and cured, they're no longer infectious. That kind of communication. And the president also held events with healthcare workers, a couple of events in the East Room of the White House where he welcomed healthcare workers home, where he shook hands with people who were just back from West Africa to show that we saw no threat to that. That kind of communication is very powerful from the White House. I think it was a big part of our response.
And I thought that this would be a good opportunity, as we got her better and she was being discharged, to completely dispel from the doubt of the public that this was some sort of a pariah now because she's had Ebola.
I have no idea what our society needs from a public health standpoint to engage in whatever future pandemics occur. I'm not a public health expert, but the lessons that I see very clearly from the experience of this Ebola outbreak that will be applicable to future situations are the way we respond as a community and as a society. Whether we choose to be motivated by fear, out of a sense of self-preservation and xenophobia, or whether we choose, in spite of our fear, to have compassion on people in need, to take action, to do good, to do what is right, not only for ourselves, but for us as a global community that's very interconnected.
We now realize that if we're going to be better prepared in the future, that we need to get moving really rapidly and get ahead of these crises, and that the White House needs to lead. We know that we have to go into these crises with our eyes wide open. They bring out both the best and the worst in us. And we know we need to be honest with ourselves. We're going to often be ill-prepared and vulnerable. Zika is now upon us, the threat that we may see an epidemic on our soil in Puerto Rico and in Latin America of babies born with serious brain damage. But we're struggling. We're struggling now. We don't have adequate funds available. The capacities are not in place. We don't have vaccines and diagnostic tools, and we face a polarized politics at home. But I remain fundamentally optimistic. We have courageous and expert leaders here at home. We have exceptional capacities that are essential for the response at home and abroad. Today, we can look back and see that Ebola and Zika have taught us that we need to do better, that too much is at stake.
Here's a lesson learned for you. If you're gonna appear on
Just grab a seat. Is there a seating order?
Yeah.
Just go ahead and grab a seat. Okay.
So everyone, thank you for your patience in watching that. We're thrilled to be able to really delve into the whole question of the media, its role, the factors that came into play, and we're joined here with Jackie Leiden, John Donovan, Ray Suarez, Elaine Cooper. You have their detailed bios with you. I think it's important to emphasize that a few things that they share. Each of them have, in some respects, looked at both domestic and foreign dimensions of major foreign policy issues. Both Helene and Ray did so with respect to Ebola. Helene won a Pulitzer, shared in the Pulitzer Prize awarded to the New York Times for its Ebola coverage. Ray produced multiple stories while at the PBS NewsHour on this that were remarkable pieces. Both are media, all of these speakers here today are media intellectuals. They are very policy oriented. They've each produced very reflective, lengthy books and personal reflections. John Donovan and his wife produced In a Different Key, The Story of Autism, a wonderful and a book that has received many plaudits. Ray produced the Latino Americans volume that accompanied the series and is busy working on a major work on Karl Marx at the 200th anniversary. Helene produced a wonderful personal memoir, House at Sugar Beach, which we had the joy of profiling at CSIS in our earlier digs over on K Street. Jackie wrote in the late 90s, Daughter of the Queen of Sheba, which continues to have a very strong leadership, another very powerful personal memoir. So we have some great talent here. We've asked them to think about some opening thoughts around the whole question of the media frenzy, that factor that we profiled in this as one of multiple factors that fed fear and panic, even though there were only few cases. What are the root causes? What are the complications or implications that come from that? We've asked each of them to contribute with 5 minutes of quick remarks. I'd like to begin by asking Ray to kick this off. Ray, you covered the H1N1 in Mexico City. You produced a 1-hour documentary, Anatomy of a Pandemic, 4 years of covering global health for the PBS NewsHour. Ray, what can you tell us to kick this off?
Well, in some ways, I could feel a sinking feeling in my stomach when I watched the Ebola timeline roll out, because in some ways it was a perfect storm of bad storytelling. Caution, vigilance, concern are all warranted when any public health threat rises anywhere in the world. And with an increasingly mobile world where a virus can be coursing through someone's bloodstream and they get on a plane on one side of the world and just travel to another, there's no longer geography or time or space as a limitation of where these things go. So naturally, concern, even heightened concern, is legitimate and a smart reaction. But Ebola came along at a time where an already existing crisis of authority and a crisis in institutions was well underway. We are deep into an era where the people that we used to more or less believe when they told us stuff are no longer believed, whether it's government and governmental officials, or educators, or doctors, or the church, or the news business. All of those that used to be largely looked to as sources of truth of various kinds. If you look at the polling around all these institutions, you'll find that people report in larger and larger numbers that they no longer believe what those people say. People in authority, people whose job it is to know the answer and to tell the truth to the public. Through that all, our business has still behaved as if we have the authority that we had at another time in the life of the country, in the life of the culture. So we go on and we tell what we know, when we know it, hopefully in the best and most accurate way possible. I don't believe that's as uniformly true as it once was. A lot of us cut our teeth in a pre-internet, pre-24-hour cable world where, in fact, you would wait until you really knew what you were saying until you went on the air or went into print. You really, if it meant holding a story for an hour or two until you could run down a last couple of sources or confirmation, you would do that because the interest in being right was much higher, unquestionably higher than the interest in being first. And a lot of these things are being renegotiated as we sit here. So it's easy to say, well, the media let us down, but a lot of things were happening all at once in an interconnected kind of way. The appetite for self-aggrandizement among our elected officials plays into this. The need to find momentary advantage, even at times when the American public is not in any real danger, I think is underestimated even by our business, where we put Mitch McConnell on, who, scalded the president for his irresponsibility in his handling of the Ebola crisis. And I was sitting there and watching it after days and days of covering this and doing several editions of my show on it and thinking, what Ebola crisis? Is someone sitting in Bismarck or Pierre or Madison or Fort Smith thinking I could get Ebola? If they are, something's really gone wrong. And part of what's gone wrong is that nobody believes anybody anymore, which only makes our job harder because we go with our pads and pens and our tape recorders and stick them in people's faces, ask them to tell us the truth, and then we turn around and tell the truth as we have been able to discern it to other people who no longer believe us. So this is not a a single variable challenge. It's a multiple variable challenge. Because there's a, I don't know what the opposite of an amen chorus is. What is the opposite of an amen chorus? Say, you lie chorus, where the minute you allege something is true in print or on the air, there are 16 people lining up to say that you're lying or not telling the truth, a la Breitbart, which will immediately come right into tow behind you and question your motives for reporting the truth as you've been able to find it during your investigations as a reporter. So it's a complicated time to be doing this job, and getting the public all hand-wringy first only makes it harder.
Thank you. Helene, can you tell us your thoughts? You gave us a little bit of insight in the documentary around the clash.
Yeah, you don't need me anymore. I'm so glad I got to see that, because I watched that and all I could think was like, God, I'm glad I don't work for Fox News. They don't look good in that documentary at all. I'm really glad this is called Media Lessons for Zika, and we're looking at how the media handled it, because it's no secret that I think this was not, by any stretch, our finest hour. I remember how frightened I was before I went to Liberia in 2014, in September 2014, because I'd been watching CNN and Fox. And even though, as a New York Times reporter and a Liberian American, I'd been reading up on the Ebola outbreak, you hear what you see, you're still influenced, even when you know better, you're still influenced by what you see. And I arrived in Liberia and walked into my hotel room that night and had brought giant jugs of Clorox wipes. I mean, I had about 2,000 of them. And I wiped down my entire hotel room. It took me like 2 hours, because even though I'd seen, Ebola's passed through direct contact with a contaminated body fluids, in my mind I'm like, well, what if the maid who cleaned the hotel had Ebola and they touched this and then I touched that? That is the level of like ignorance that somebody who really should have known better, took with me. And it was being in Liberia that actually, educated me and just calmed me the heck down, because once you're confronted with the reality of how, of people who are very, very sick and how this is spread, and people who are dealing with it. And in Liberia, I'm very, as a Liberian, I'm proud to say there are times my country people, my countrymen and women exasperate me and I'm pulling my hair out, but this is one instance where I was so proud of them and how they were handling it, and how it became very clear to me there that the people in Liberia who were getting sick were either healthcare workers or family members of people who got Ebola. That was it. Nobody was catching Ebola because they were walking down the street and brushed up against somebody who had Ebola. Nobody caught Ebola because, they went to the supermarket. You caught Ebola because you took care of somebody who had it and who was very, very sick. And once you realize that it's the education of the disease, by the time I left Liberia and came back here, I understood that I did not have Ebola. I was taking my temperature, 5 times a day. You can't go around Liberia without entering any building without getting your temperature checked and all that. And I knew I didn't have it, but I wasn't prepared at all for the firestorm that I walked back into when I got to Dulles Airport. And then to my house, where my entire, I live in one of the best neighborhoods in the world, but my neighbors were basically like, we're gonna build a fence around your house, don't even think about coming here. And I really wasn't prepared. And I work at the New York Times, and they told me not to come to work for 21 days. And it's just like, and I remember I completely understood why these people were reacting that way, because I had felt in some ways the same way before I went to Liberia. But it also just made me angry, but also just so disheartened by just the lack of education and the lack of facts in our media, in the media reporting, and particularly, and I will call them out, I thought CNN and Fox were appalling. I wish we had, I mean, I wish we had some of those people up on the panel right now, because I think a lot of this should be discussed with them. And I understand TV ratings, and I understand that we're going into, at the time we're going into a midterm election cycle, but I mean, I think there's something, I think the media needs to be held accountable for irresponsible reporting, and I would like to see, it's really easy for me as a New York Times reporter, because this was one time where I was actually very proud of the way my newspaper handled coverage of Ebola. So it's one thing for me to sit here and talk about the media reaction, but I think there are a lot of people who really should be called into account as well, and I'd love to see Fox and CNN talk about sort of the tone of their coverage and why it had to be that way.
Thanks. John, your thought?
I want to congratulate you on the film. If this is a first outing, it was very, very nuanced, but moved along and was quite gripping and eye-opening. And in itself, it's something that I think the general public would watch with enthusiasm and a sense of getting it, because they remember living through it and sort of seeing all of the correctives in it and the discussion that went along. They went along with the public, the media. On that one.
Thank you.
And I also want to say, Helene, as somebody who spent many years going to the field and having tension with the office back in New York about what reality was, that I give you all respect for having gone there. Even if you found that your fears were exaggerated, you still got on the plane and went. And I think that in all instances, editors need to defer to the people who are in the field, and they're not very good at that. So congratulations on your Pulitzer. It's really earned and well-deserved. That said, the media is a plural word, and I think it's too much to say the media blew it during Ebola, because so much of the media didn't blow it. I think, to quote somebody on this panel, CNN and Fox were appalling. But I also noticed that the film relied an awful lot on the appallingness of Fox and CNN. New York Times wasn't appalling, NPR wasn't appalling. ABC News, the organization I'm still associated with, was not appalling. And I think that's largely because we have our senior medical correspondent who used to work for the CDC, Richard Besser. He's smart, he's level-headed, and people listen to him within the organization. So I'm a little concerned about the notion of absolutely saying there was a media firestorm and the media made a lot of mistakes, because I think a lot of the media was pretty responsible. I didn't have a good sense of what was happening on local news, but in terms of the national, I think the main culprits were the ones that we saw in the film. And that's important, because those channels, and also MSNBC, by virtue of being on 24 hours a day and keeping up a constant conversation, do set a tone. And you can always flip by, and during that period they would always be talking about it. As right now, they will always be talking about something. And that's the nature of the beast. It really started, I date the change in how the media works to 1994 and the O.J. Simpson arrest, and that's when NBC News discovered that if you take one story and do nothing but that story, your ratings go up. And soon that was followed by other organizations. Before the 90s, and I used to work for CNN, we would change the story every 2 to 3 minutes to something else in the world. But the idea of let's take a narrative and keep going and going and going was one that now we have 25 years of journalists growing up in the system. And it's not because, I don't think it's because they're entirely cynical about it. They don't have meetings where the journalists sit around and say, what can we do today to get our ratings up? It's more a sense, I think, of what's important, what can we add to the conversation, what's going on, what touches people. And to a degree, I think these channels that are on 24 hours a day are trying to channel public interest and concern. Yes, of course, bottom line, that does have to do with ratings. They want people to watch them. But I think the conversations that we have when we sit around is not, if we do this, we'll have a spike in ratings, but if we do this, people will watch us because they'll think we're relevant and they think we're important, and let's contribute to it. And I think the people I know at CNN are serious people and are serious journalists, and they do go to journalism school to do good in the country. But then they get into this business model where this other thing is going on. And they look at a world where I think a lot in terms of this channeling of the public. What does the American public want? What does the American public come to understand? I think by and large, even though we live in a very insecure world, there's a desire and an almost expectation that we get to live in a risk-free world. We're uncomfortable every time we have a sense that the world is not risk-free. We've grown up in a world of antibiotics and emergency medicine and dramatically expanded lifespans. And it makes us very, very uncomfortable when there's a sense that maybe there's something wrong that's going to sneak up in the night and hurt us. And at the same time, there's an exaggerated expectation of what medical science can do, an over-exaggerated medical understanding of what medical science can do. You see that in all kinds of campaigns that, you know, if there's a drug being developed and it's just being tested, and many, many stories will show up on the air about such and such patient wants access to that drug in development and they can't have it. Well, why not? They should have every shot they can in expanding life, and they intervene and intersect in an unpleasant way with science when the drug developer won't let the patient have it, and the media gets behind the patient, not understanding how science works, with the whole notion of, well, everybody has an opportunity and a right to try to live as long as they can. Science is there to serve them, which of course it is. There are many, many places where there's this mix-up between science and public expectations and how the media works between them. It's a particular note to me. I happen to be married to a physician. My co-author on the book is not my wife, by the way. That's okay. My co-author is a mother of a child with autism who's an ABC producer. But my wife is a former journalist and still writes, and she's a medical professor at Georgetown University. And she's been a real educator for me on sort of the limits to science. So I think what we saw in that time period was these two channels upping the ante, upping the fear on the remote possibility that maybe this disease was going to go crazy in this country. Was that such a ridiculous thing to worry about? I don't think so. Everybody's nodding yes. I don't think so, not knowing at the beginning very much about Ebola. What I know about diseases taking over is that Hollywood has helped us imagine it. We've seen Dustin Hoffman in the hazmat suits, and we've seen the story told to us that a virus could get out of control, or a bacterium could get out of control. And we will be told by the scientists that it can't be spread through by air. We will be told what the actual contagion possibilities, the contagion factors are, but the scientists are terrible at explaining it. They're just terrible, and they're up against imagination. They're up against the public imagination. And the journalists put anecdote against boring scientist. And the scientists being scientists, will report the facts. And they'll hedge the facts because that's what scientists do, because they can never really say anything absolutely. And so there's two kinds of narratives conflicting and two kinds of dialogue between patients who are sick, the pictures from Liberia, pictures from Sierra Leone, versus a scientist in a white jacket, a white coat back here saying, well, it's going to be okay, it's going to be okay, versus the Hollywood thing, versus journalists who don't know what they're doing. Even Helena, who won a Pulitzer Prize, went there and spent 2 hours wiping down her room, not knowing, a very sophisticated person. I'm married to a doctor. My wife was going to Rwanda in the middle of all of this. She does a lot of work in Rwanda and the Democratic Republic of Congo. And I said to her, I'm embarrassed to say, should you be going to Rwanda in the middle of this Ebola thing? And she gave me this, please tell me that I'm not married to this dumb guy. Look, she said, you know it's 3,000 miles between Rwanda and Liberia. And I said, oh, yeah, I know that. She said, you know that's Maine and San Diego. And I said, yeah, I know that. And she said, but still, is it okay? And so, you know, it took some sophistication for me to catch on. And I had very, very intelligent friends worried about this thing happening here. So I don't think you're an idiot if you have these fears. And I think, I'm going to stop talking because I've gone way over my 5 minutes now. My bottom line would be, I think that for the most part the media was good, but they're not heard when they are. I think the scientists said the right things, but they're not heard. I think the last element in this was the political thing going on. The fact that there were candidates who were exploiting the situation to look tough. I don't think their aim was to be xenophobic, but ultimately they were. And an interesting thing, I had a conversation yesterday with the communications officer at Georgetown University Medical School, Karen Teber, and I asked her for her perspectives on what's happening. So it was really interesting to me. She said, on the one hand, I saw Americans paying more attention to Western Africa than they had in 20 years, and that was a good thing. She said, on the other hand, the day after the election in 2014, the day after the calls she was getting, she had been flooded with calls the day after the election. The calls on Ebola stopped, which goes to your point.
Thank you.
Sorry I went on for 15 minutes.
No, that's true.
So,
Jackie, come in.
well, thank you, Steve. I was so pleased that I got asked to work with CSIS on this. I had never done a public health story in this kind of depth before. And I have grown up with NPR. I'm emeritus at NPR now. I freelance a lot for it, but I'm no longer there, technically. And why I bring that up is because I worked for one organization my entire career. And why I think that bears on this, if you'll give me just a moment, is because until we had pictures, we had to use words to talk about abstracts like fear. And there are many ways that our human emotions override our logic. And we saw that in the Ebola story. I went over NPR's coverage with my colleague David Folkenflik, who is the media critic that NPR employs. And David has to cover us as well as outsiders. And he said, look, NPR performed admirably in its civic function as an educator, and in terms of fact-checking and pushing back on truths. Having said that, NPR has done 412 stories on Ebola since the beginning of the crisis, more than 200 in 2014, and won a Peabody for its coverage, sent teams to West Africa, and more than 100 NPR member stations helped to report on the public health crisis in the United States. And in fact, other news media take a look at NPR when they are trying to fact-check their own stories. So I feel very proud that that sense of deliberative editorial judgment does still take place. Having said that, I was interested in a story that NPR did, Rob Stein, one of the science reporters, on August 22nd of 2014, The Dread Factor, Why Ebola and Contagion Scare Us So Much. And it's interesting, John mentioned these movies, Contagion and Outbreak, because they have a profound subliminal effect. Things like that do. And at that time, in mid-August, Harvard did a study, the School for Public Health, on what Americans thought about Ebola. And between August the 13th and 17th of 2014, 4 in 10 people thought that they were likely to somehow contract Ebola. So it goes to show that as sophisticated a society as we are, all these different centers of authority, media, government, public health officials, have a tremendous responsibility, but so does the public. You know, anyone at any point on any given day could have gone to the CDC website and educated themselves on how one might contract Ebola, but people don't necessarily do that. What this film gave us a chance to do, this documentary, was go back to people like Tom Frieden, and I never knew that he was receiving death threats. I don't think most people did. And so the authority needs to be able to talk directly, I think, without the filters we have. Unfortunately, that's not going to happen in a binary world like a CNN or Fox News, where you are either all in, doing it on that kind of cycle, or you are doing the kind of press that is going to be more reflective. I guess that's in some sense a pitch for the kind of reportage that gets facts out there first, but even so, you have to keep doing it again and again. And not many of us are on this 24/7 on one story news cycle. So I think that did overwhelm public judgment, and we saw it moderate over time. I want to say more about it as a First Amendment story as we continue this conversation. I'll go back to our moderator.
Okay, thank you. So, Ray, you emphasized that the media's playing a little bit of catch-up, that there's been a lapse of public confidence and faith and authorities, that's the environment we're working in. Helene was emphasizing that the power of cable, of the all-news 24/7 cable, I think this comes up in John's comments also, that power is overwhelming. It crowds out other worthy voices, and it creates, and that scientists and responsible media are competing against much more powerful forces. And your appeal was for accountability. And Jackie, you're reminding us that that journalists are still puzzling over exactly what all of this means. I mean, as you were sort of going through these surveys. So when all of you think back on this, would you have done things any differently as a practicing journalist if you were covering this story, or is that just too micro? Helene, you were an award-winning journalist in this period. Was there any way to alter the way that journalism behaves in this period in order to mitigate these impacts?
I think there are always ways to alter how we behave, but I don't know that that was something that in the moment I was thinking about. Mm-hmm. Because as a journalist, you're always, the first thing you're thinking about first and foremost is, I want to do as good a story as I can. And I want it to be accurate. I want to get to a point that other people may not be seeing. And what I felt when I was writing about Ebola, what was the most important thing to me was to sort of figure out a way to write for an American audience and to make my American friends and colleagues and fellow citizens understand why it was that the people in the country of my birth were behaving the way they were behaving. I had felt a disconnect at the time between what I was seeing here, because I was getting so many questions from people here about why is it that people in Liberia keep touching each other? Why, if they know they're going to get Ebola, why is it that they don't, just like stop touching other people? And I wanted to sort of explain. I wanted to understand that myself, and I wanted to figure out a way to try to make this group here, us as Americans, understand what West Africans were going through. I also wanted to figure out a way to convey to the Americans, and I think Ray touched on this as well as John. We do live with, our tolerance for risk in the United States is very, very low. And in other parts of the world, people have a much higher tolerance for risk than we do. And that's one of the great things about being an American, and that's one of the great things about living here, is that we value our lives extremely highly, with good reason. And I think there are many other much poorer places in the world where it's not that these people don't value their lives, it's just that they are able to tolerate a much higher level of risk than we seem to be able to, and I wanted to get that across. So I had a lot of conflicting agendas, and I don't know if perhaps I don't know that I necessarily succeeded in doing all the things that I wanted to be able to do in the coverage. I think I'm pretty sure I didn't. But we come to this as journalists, we're still people, we're still bringing all of our own baggage to the table as well. So there are always ways that we could have done better stories, we could have done more powerful stories, and we could have educated people more. But at the end of the day, we're always going to look for the fancier lead, for the anecdote that makes a compelling point, and we're always going to go for what's going to interest you much more than we're necessarily going to go for what's going to educate you. And I think that is something that we as journalists have to grapple with day in, day out. How do we educate you and educate ourselves while at the same time we're keeping your interest?
Well, you talked about wanting to see accountability. I mean, one of the things that came across to both Jackie and me when we were in Texas was the people that were working the issue day in, day out quickly came to conclude that people that came to their door claiming to be media were somewhat predatory and couldn't be trusted, and they began to actively fear them. And I found that shocking. I mean, it was a sort of, it was, you know, Judge Jenkins talking about who are these Breitbart guys? And they purport to be media. Next thing I know, they're going after my children and after my wife.
That's a shocking
I mean, there was, and that was not the only story. I mean, there were, you heard Allison Liddell talk about the invasion of her private home. People, you know, and so what do you had a call for accountability. I think you were talking about cable, mostly about 24/7 cable and the power of that. But it was broader than that. It was a sense of media that didn't have the ethical standing of all of the outlets that John, you know, cited as having done a great job of covering this. There was this feeling that, you know, it had fractured into multiple parts and become insidious in the way that it was operating, and that was some of the perception by those who were working the issue or watching closely. John Corso, the gentleman from the Dallas Medical Society, talked about how there was an appeal made. This gets to Ray's point. There was an appeal made, desperate appeal made to the Medical Society in Dallas to get out and at the neighborhood level talk to people, because the collapse of trust and confidence in what the authorities were trying to communicate and the overheat on the media side was leading them to fear that there was going to be, you know, that they were on the edge of breakdown. That if
Schools being canceled.
If there'd been a second wave of infections, and at one point they thought they were walking into a second wave and they were preparing themselves for what the consequences were going to be, they were really fearing these. They were beginning to see this. So what are the concrete steps, do you think, for rolling any of this back?
Well,
I don't think you can.
I think it's, yeah. Silence. We, NPR put quizzes on the website asking people if they could match politicians' statements with things they had said about Ebola. I mean, they did that on Election Day. And I think that does puncture the idea that someone could say anything and it would be scot-free. I mean, more and more and more, we're seeing, even as we sit here, people who will say anything and think that we are living in a fact-free environment. Well, as journalists, we know we don't live as in a fact-free environment. As thinking people, we know that we don't. But that doesn't mean that, you know, there aren't, I think we all know who I'm talking about, individuals who don't try to bend the truth. And that is something you're seeing all kinds of, you know, Congress even trying to refute a constant stream of misinformation. And so when it comes to real threats, like we have with a pandemic, I think media really does scramble. I just thought it might be interesting to take a little look at this quiz and try to match what different politicians said at different times. And if I were to say to you, which politician said that the idea that terrorists infected with Ebola are deliberately trying to attack the United States, and I threw out Senator Ron Johnson of Wisconsin, Tom Tillis of North Carolina, Chris Christie of New Jersey, Andrew Cuomo of New York, which of those individuals, which politicians, who matches that statement? It was Chris Christie of New Jersey. So when you have people in authority saying things that, as a journalist, you know are patently untrue, it's not almost sexy to say so-and-so lied today.
But I think that as press, we're getting better and better at calling out people when they misstate something deliberately, and we have got to
We have a lot of
start
practice
doing that
lately
more.
in
Yeah,
that.
we're getting more practice every day. And I think there is a timidity when a story is really heavily scientific. If you're not a science-based journalist, I've never been a science journalist, but I've hosted, thousands of radio shows. You're thinking, do I have enough knowledge to challenge so-and-so? And I think we have to get less timid at that.
But the thing that's infuriating about all this is that your real risks are hardly discussed when we're having like a jamboree of fake risk.
Right.
2 people died of Ebola in the United States in the same calendar
Who's the second
year.
one? I keep hearing the 2. Who's the one besides Duncan?
I was kind of wondering the same thing
Yeah, I think-
coming over here. I was
Is there
thinking it's 2.
somebody else?
I can only
Who's
name
the
one.
two?
Who wants it? Yeah.
I think somebody was brought already sick and died once they got here.
Okay.
Oh.
Yeah.
He was treated and died.
Okay, thank you. Sorry. Sorry.
And that same calendar year, thousands of people died of hospital-acquired infections. Did you see any media free-for-all around that? Things that we actually have known protocols to save thousands of people's lives? It's crazy. It's just crazy. And yet, here we are, sober-sided, pious people who try to do a good job, and we're trying to have listeners, viewers, and readers come away from our products better able to assess their own risks, better able to understand where they fit in the great big range of risk, and we're outflanked by people who are willing to suggest to them that they are in far more danger than they really are. Well, what's more exciting? Scary nonsense or boring reality? And that's what we're up against. When they go to a commercial and say, "Is your family at risk?" We'll tell you after this. We already know the answer to this question. Your family's not at risk in Boise and Billerica and Bal Harbor. It's not at risk. Nothing's going to happen. We didn't have any Ebola cases in any of those places, nor were we ever going to. And yet, the real truth of an international medical emergency response in post-conflict, there were serious things to talk about Sierra Leone and about Liberia and the nature of those societies and what kind of help they would have best served the actual size of the threat. And we never got to that because everybody was busily sending West African descended kids home from school. Well, seriously. That's where we were at. It's hard to know what to do in response to that.
Well, there is this contagion of fear, right? And so it's predictable in some fashion. I think we're likely to see this as the Zika infection spreads and as we see more births as a result of folks infected. I think we're likely to see another wave of intense fear and dread and panic coming from a fairly limited number of tragic cases in this country. So what do we do, John?
Well, as an individual journalist, the problem is an individual journalist doesn't have that much impact. But as an individual journalist, I would try to be sober and sober in the way I approach the story and try to educate myself. Then I would try to find, if I decided it was my mission to have to compete with nonsense, and maybe I do have to decide it's my mission to compete with nonsense as opposed to just go out and get the facts. Because there's no such thing ever as just going out and getting the facts. No story is ever just getting the facts. You have to make a decision about what your agenda is, consciously or unconsciously, and if you're making a decision, it's pretty conscious. So if I feel that I'm in a climate of silliness and exaggerated fear, and my mission is to do something about that, then I would need to find a way to be really, really compelling, because just going and interviewing a scientist isn't going to do it. And the The reason is, and I would go back to the business that we're in. We're in a business where if people don't watch you in sufficient numbers, you go out of business. It just happened to Ray's organization, Al Jazeera.
So if you hear anything.
Fantastic journalism, like the best television journalism that's come along in the last decade. And people didn't want to watch because it wasn't that exciting and they didn't exaggerate stuff. It's very, very unpopular to say, and we always, in this whole sense that the customer is always right, inside the media we always have to pretend that the audience is really intelligent and that we have to respect them. But I'm very angry at the audience because the audience chooses to watch garbage over serious stuff. It makes it very, very difficult to compete. So simply going on and soberly reporting the facts is not going to be enough. You would have to go figure out a way to, and especially nowadays, to take on an adversarial position with the nonsense brigade by being sharp-edged about the fact that it's time to stop the nonsense. It's time to do a piece, it's time to do some reporting, almost in, taking a note from Jon Stewart, mocking the ridiculousness in order to, but that's not what I got into this field to do, but that's sort of where we would be now in order to top that, if you really want to do it. I really don't think merely going out and assembling the true facts of the science would be enough. So that's what I would do as an individual.
Hasn't Trump pushed much of journalism into that posture in the last
period? Month, I would say so, yeah.
In terms of, you just see story after story that starts with a rebuttal. It's become rebuttal journalism.
Since he became the presumptive nominee.
Yeah,
right?
but for most of the last year, no.
Right.
And why
so
did
nonsense reigned, and now we're in the post-nonsense period.
I think in the past,
beginning of it.
Yeah, I think John is right. I think we're starting to see that. I think in the last year, and several friends of mine, colleagues of mine, talked about it, saying, I don't think journalism is able to handle, has any idea how to handle Donald Trump. We're not ready for it. We don't know how to do it. It's just we're so trained to give this appearance of neutrality, and that we end up putting this moral equivalence on everything. Yeah. And that can be, that doesn't work when you're dealing with politicians who lie and people who...
We would never have said that on a panel a year ago about any other candidate that belongs to a party to say the Republican candidate is a liar or the Democratic candidate is a liar. We would never have done that.
No.
But I'm going to say now the Republican candidate is a liar.
Yes, and we do it.
Because that's the truth.
Way to go.
And that's cleaner than what you said when you were watching him on the...
But I think we're starting to see those stories now. Those are coming, that's coming out.
I had an example of that. I was going to bring up that I think that journalists need to quit being uncritical of other journalists. And I think there is a professional sort of unspoken, well, I won't publicly criticize so-and-so. And it is too bad we didn't get someone from one of the cable channels here. But it's not just the cable channels. I'm looking at, maybe some of you recall Nancy Snyderman, the correspondent for NBC, who came back from West Africa, and she did undergo this voluntary quarantine, mostly because she didn't want Governor Christie putting her in quarantine as he had Casey Hickox. And then she went out for soup. So what is the chit-chat the next day on that show, which probably seen by more people than NPR combined, The View, with Whoopi Goldberg. And Whoopi Goldberg is criticizing Snyderman and saying, I don't want to see you looking out for soup. I'll take you for soup after your 21 days. Well, I spoke about that with our media critic today, and he said, what Snyderman did wrong was not go out for soup, but what she should have done in the beginning was not do the self-quarantine, say it wasn't necessary, take a position. So I think what I mentioned the word timidity in my opening remarks, and I think that we have been tempted by timidity more than we've been tempted by boldness. We always want to play it safe. No one wants to stick their neck out, get it wrong, be a lightning rod, because there's this immediate billions of Twitter followers, right, who can attack you. And that's the other thing that's made it trickier for people like us. We've seen the Donald Trump be able to basically bypass not only the Republican National Committee, but a lot of media just with Twitter. And I keep thinking, what would have happened if the Ebola crisis had happened right now, right in this environment we are in right now? Another thing that our media critic thought that the White House had done not as well as it could have is did quite a good job, he thought, in terms of handling the Ebola crisis, but not a good job at articulating how it was handling it. You know, Ron Klain doesn't get appointed until what, October 16th?
Third week of
Third week of October. And they actually had these innovative things they had done in terms of the narrowing of the closed loop of traffic of people coming back, which we put into our documentary. But it didn't necessarily get that message out. Once it did, President Obama took time off, did a lot of things right. But again, you know, trying to tell that story when there's a din going on out there of noise, you know, it's challenging.
Let me mention that we should be careful about what we wish for. One year I interviewed one of the top anchormen for Chinese state TV. And I asked him about SARS. Because in the past calendar year, they had fought the infection, and he told me, and this goes to show you how different ethics and worldview can be from country to country, that they were aware that there had been an explosion in the number of cases in a region of China, and they asked the government whether they should go ahead and report it. And the government told them no, because they didn't want to create panic. So they didn't report it until they got the high sign from the Ministry of Health, and then they went ahead and started to cover more accurately the number of cases. And he said to me with disdain dripping in his voice, "I know how you American journalists value the scoop," he said. But we also have a public responsibility not to sow panic in the population. And it was very important that we worked hand in hand with the government to have a more controlled, more careful release of the information so that people wouldn't be fleeing regions of the country and so on. Now, SARS, you'll recall, within 72, 96 hours, was in Toronto and Sydney and Hong Kong and Los Angeles, and it was not highly lethal, but highly contagious. And it was in part because of this lack of concern in the country that was experiencing the outbreak that was leading to something that could have just as easily spread around the world. H1N1 was in Boston, in London, and again in Sydney. You know, people love to get out of Australia for some reason and go on vacation. It was around the world in just a few days. And again, the world caught a break, a very low level of lethality and a very high level of contagion. So you could pass it as easily as that, and luckily most people didn't get too sick. But you know, we live in a world where we caught a couple of breaks like that through no virtue of our own. The world didn't die, and we didn't have to peel off the top of Gwyneth Paltrow's head, poor thing.
Well, one of the aftermaths of the China experience was they became much more responsive, transparent, and accountable later downstream. I mean, the mistakes were so huge. I don't think anybody, Ray, is arguing that there should be some kind of authoritarian intervention to withhold. I think it's the question of to what is the degree of responsibility to engage in an active rebuttal, a rebuttal of other media that are spreading untruths, and versus simply trying to create a counter narrative that you hope people will latch onto in the midst of the sea of other things. Let's open up here. We've got another 15 or 20 minutes. If we're going to gather together 4 or 5 quick comments. Please identify yourself. There are microphones that we'll bring to you. And please identify yourself and please offer one single quick intervention.
Okay, my name is Phil Thomas. I'm a professor at George Mason University School of Policy and Government. And I'm struck by the elephant in the room, that you haven't addressed social media and how that feeds this paranoia.
Thank you. Over here.
Hi, my name is Halla Flynn. I am a writer for the nursing program at the University of Southern California, and I wanted to ask a question about the balance of the media's role versus the public's role in approaching the stigma of people who are affected by disease and the long-term effects of Ebola and Zika in the future.
Over here.
Tim Stevens, I love it that you brought up the concept of the responsible media. I hope you can develop that a little bit more. But remember, 2 years before that, what I might call the media public health complex was celebrating how it had brought issues of contagion forward in the movie, the Gwyneth Paltrow movie. And so maybe there is some back and forth between the media and certain public officials that fits that responsible category. But that same responsible category is perhaps the CDC that suggested 500,000 people on September 21st were going to be affected by Ebola. Maybe challenging that would have been just as helpful in terms of that frenzy we've talked about.
Thank you. There's another hand right here, and then we'll come down here.
Hi, my name's Nadine Richardson. I'm from USAID. I have a question in terms of follow-on reporting. We're seeing more survivors issues and transmission prevention issues, and there's been very little coverage of this. And I would like to ask, in terms of responsibility of the media, when it's at its highest point, it covers it quite well, but when it is forgotten, those same people are somewhat neglected. So at what point does the media feel a responsibility to continue to cover something or move on?
Thank you. Let's take one other here, and then we'll come back to our speakers. Yes, please.
I'm going to try to be quick. So I actually worked on looking at the impact of fear in Nigerian Ebola outbreak, and incidentally, I was quarantined when I came back, but luckily it didn't last more than 3 hours. My comment is about, obviously media can play a very key role, and it can play a role in changing perception of diseases, which is a major issue when in times of pandemics. It can, obviously fatality rate changes perception, but how media sensationalized was a concern. And the second thing was fragmentation of message. In United States, even though you have CDC and you have guidelines which WHO and CDC had applied, everyone was an expert. The message was very fragmented. If you compare it to a country like Nigeria, which actually controlled the disease very quickly, there was a very synchronized message. They were cooperating with the ministry, and the message was being relayed was the message being provided by the ministry. And what Tim Stevens said, and I think what Helen and Ray and all of you on the panel mentioned, nothing spreads like fear. And I think the impact of fear is very underestimated. And even in SARS, after the news broke out, $40 billion in 12 weeks were lost by the economy. So again, something to think about when we think how the sensationalization of news can impact the economy. Thank you.
Thank you. We've got a number of issues out there. Social media, stigma, what does it mean to refer to a responsible media, survivor issues, and this fragmentation of messages. Helene, why don't we start with you and kind of swing down and hear from all of us. Which of those would you like to respond to?
All right, I'll take social media and then I'll take the follow-on reporting. I spent so much time on Facebook unfriending people during the Ebola crisis that I probably should not necessarily be the one to talk about. I mean, I think it's, yes, social media definitely, I think, spread this whole fear, this feeling of fear, because with social media, you can pick and choose, and that's what social media does. You pick what you want to, the outlets that you want to listen to and the outlets that you want to read, and then you share that, and it sort of amplifies and amplifies. So I think it definitely contributed to this. What I found really interesting is social media also gives you these weird insights into people that you hadn't realized. Perfectly normal seeming people who I thought were sane were putting things. I remember a very close friend of mine from high school who put on there that she wasn't going to go to the bathroom at the airports anymore because of Ebola. And I was just sort of like, wow, this is a new one. On follow-on reporting, the Times, I can't speak for, I don't think you're going to see a lot of survivors reporting on Fox or CNN, but the Times has been doing a lot of stories about the after effects, about survivors. I've been back to Liberia 4 times since September 2014. Sherry Fink has been back to Sierra Leone. We've got Dion Searcy, who's based in Senegal, but we have definitely done a number of stories, both on the fact, which I find very frightening, that a lot of what we thought we knew about the disease itself, and I'm not a medical reporter, it keeps confounding us, and it seems, the fact now that it apparently stays in semen for 6 months or even longer. People are not sure anymore. A lot of the assumptions that we had about Ebola are not necessarily playing out. But then also, and this speaks to the stigma issue, just how all of these people in this country, because a lot of people survived. In Liberia, I think the survival rate was like 58%. And how they are managing now. And there have been, so if you, just Google the New York Times, you'll find your stuff.
Ray? Follow-on reporting is really expensive. It's as expensive as the first go-around, except without the tremendous support inside the newsroom that the first go-around had. So convincing your bosses to extend the resources for you to go back to a place where now the story is much less apparent, much more subtle, and much less on the public's radar is really tough. Social media, where news organizations are trying to use that world as their friend to transmit stories that are linked in people's posts, to embed content in what people send to their friends. We're trying to profit by and be advantaged by it without recognizing that it's also a double-edged sword that very much operates out of that crisis of authority, where what you say can be doubted with no basis in fact at all. I've seen tweets doubting the veracity of my reporting that are based on nothing except somebody's feeling that what they know from absolutely no evidence is truer than what I know after actually working on it. So it's a world that hasn't yet settled out as to its effect, or it may just always be like that, and we're just going to have to live with it.
John? Well, I think social media is having the impact of making the more traditional news institutions that we all have represented at one time or another in this panel much smaller than they used to be. Their impact is smaller, maybe to some degree harming their relevance. And in addition to that pretty dire portrayal, I would also say that I think the expectations of some of the questions that you've asked in this last round make an assumption about the media as an institution that I think are unrealistic. I'm really adamant in saying there is no the media. Media is a collection of individual journalists and individual organizations that hire those journalists. Sometimes I think for people to refer to the media is like referring to the artists. The artists, they've got to paint these kinds of pictures. They're not painting these kinds of pictures. They should paint these kinds of pictures. And I'm not saying that we are artists in that sense of that effete sense, but I'm saying we're sets of individuals with individual agendas, backgrounds, goals, aspirations, ambitions. And the expectation that you might have that there's an institution, as though we were elected or appointed to be high-minded, always high-minded guardians of the truth in some comprehensive way, such that we would have a responsibility to do a follow-up story, I just think is unrealistic. We get to do, and any journalist gets to do what he or she or his boss wants them to do. And what that thing is, usually is, be interesting, not find out what happened to the story we reported on 5 years ago if it turns out not to be interesting. Everybody in this room is concerned about this particular issue. But right now, we could all go to Peru and do a story about the agricultural crisis. How many of you would watch that story if we're going to be comprehensive about the globe, if we're going to pay attention to everything that's going on in the world in a responsible and serious way? Nobody will watch it. I'm sorry, unless we make it really amazing, or unless, I hate to say it, Bono goes there or something like that. That's how so many stories that have been reported out of Africa ultimately happen, is some white guy goes to Africa or singer and brings a retinue of reporters, because it's become interesting by virtue of that in terms of this culture. But the expectations that you seem to have for the fact that journalists comprise an institution, I think, are unrealistic. And the best you can hope for is to find individual reporters who have courage and guts and integrity, and find out who they are and follow them. The problem with that is you might get into your little echo chamber world where you won't listen to other journalists. But that's, I think, the best you can hope for today. And even some of the people on Twitter are going to be pretty good at it as they make us smaller. Some of those individuals are going to be good at it, I think, and most of them won't, and you're just going to have to choose. But you always have had to have chosen. And I've just always thought, I went to journalism school, and I think the big mistake of journalism school was telling us all that we were all part of the same thing, and I no longer believe that. I think we're not.
Jackie?
I would agree with a lot of what John just said, and I think when you were talking about the artists, it made me flash on, just the other day I had lunch with the president of the Authors Guild, and she was very concerned about a court ruling that's gone against content creators and Google and Amazon being able to publish their content without compensating them. Are we being erased as storytellers? And I said, well, what you need to do, Roxanne, is get some celebrity to be reading a book and then erase the celebrity, and the book vanishes. It's kind of a little like that with this story. People have to, there's a certain responsibility for education. You talked about not having follow-up. So I came in with some follow-up. March 27th, NPR did, WHO says Ebola epidemic is over. What have we and haven't we learned? And it's a massive take. If you printed it out, it runs to nearly 10 pages on what could we have done better. Why did we let fear dictate the quality of clinical care? Was perhaps some of Paul Farmer's remarks on what if it wasn't such a lethal disease but mediocre care? Many, many questions yet to be answered from these things. And I think that if you are a keen consumer, if you will, a keen reader, a keen listener, a keen viewer, as I'm sure everyone in this room is, then I think that you are already so far ahead of the curve and have some responsibility, just as we sitting on this stage do, to push back against misinformation, to push back against fear. We're not just people gathered around wells anymore talking about, the witch that flew in the window and scared so-and-so last night. So we all have, I think, if there is a new model of citizen journalism that comes from social media, then when you see something, say something. I mean, is it that simple? I think part of it is, having gone, through all this too.
Yeah, you look at last night, I was home and I watched the events taking place in the Capitol via non-professional journalists, and then I was wondering what was happening in front of the Capitol. So I went on Twitter to look for photographs and found all those individuals did their journalism for me. I think, and CNN was relying on those, so CNN got a little smaller in that moment, I think. So
that's how powerful you are. Institutions like this one.
Another time when the media got accused of not doing well was when we went to war in 2003 in Iraq.
I thought about that, getting ready for this.
In that case, I just remembered now, I'll make this 1 minute. I was not embedded with the military. ABC wanted people in the field who were not embedded to see what would happen. It was incredibly stupid, dangerous thing to do. I now realize, to go in, and I had small children at the time. We had no protection. But what my colleagues and I, a producer named James Blue, now is with PBS NewsHour, and I found when we went into Iraq, at the point in the story, in the second and third day, when all the embedded reporters were reporting, they love us, the Iraqis are cheering, and there's a guy slapping Saddam's picture, and the statue's coming down. That was actually a few weeks later. We went in and found that the Iraqis were furious with us. And in southern Iraq, they had no electricity, they had no water, the hospitals had shut down, there was no food, and people were very, very nasty to us. And we tried very hard to get that story on the air. And for a few days, ABC didn't believe us. They didn't put it on because the story was that things were going so well. Now we forget that we went through that moment, that week of, wow, this is going so well. And ultimately, I called Peter Jennings, who was a spectacularly good and honest journalist, and I appealed to him directly. I said, Peter, I'm seeing a different story here. And he put me on the air, just doing a live talking about what we had experienced. Based on that, Nightline, the next night, did have James and me do a story that was the counter to, we actually literally did the rest, everybody else's wrong story. And it's one that, you know, once events began to vindicate our position more, ABC became very happy that they had put that they were on the record having put that story on. But James and I set out to make it a very compelling story. Like, let's find a way to tell this story so that people will watch. And we made it a road, we turned it into the narrative of a road story through southern Iraq. So it was a rhetorical storytelling device to be cute and gimmicky and clever, but to make people watch. And it worked at that level. I mean, it really, really worked well. But it was one time when we felt uncomfortable. Are our colleagues going to hate us for saying that they are being taken in and duped by their inexperience and by the fact that they're stuck with US troops and can't see the rest of it? So it can be done, but it was uncomfortable at the time.
We're getting to the end of the hour here. We knew ahead of time that the discussion here was going to range more broadly, simply because the issues that we're talking about have such broad application. So I want to take advantage of that and ask you all one last question, which is, here we have a presidential candidate that is openly calling for rollback of press protections, right? For calling, who's singling out different outlets to ban selectively, but also raising the specter of rolling back the liberties and protections that the media have. What do you think the implications of that being out into the open political environment as a somewhat pretending to be a legitimate idea? What does that mean, do you think? I feel like I have to ask you all this since you're here and you think about this.
It's going to get a lot of support. There'll be a lot of people nodding their heads, but just the fact that he suggested it is a demonstration of how little he understands about how the Constitution works. So you can either be disturbed by that or reassured by it. I don't know.
Elaine?
I agree. I mean, I think we have founding principles, and we have a constitution, and freedom of the press and freedom of speech is, you know, it's not something that we really muck about with. So I don't really, there's a lot of things that Donald Trump has said that have really frightened me. That is not one of them.
So that doesn't really shake you. You're not.
No, there's a lot of things he said that have frightened me much more than that.
Thank you. John?
I'm very bothered by it and other things he said, and I'm bothered to see stadiums of people cheering for them, because I think that between him on the stage and the crowd cheering him, that an air of legitimacy comes to the point of view of to the assertions that he's making, the xenophobic assertions and assertions about the uselessness of things like the First Amendment and other amendments, although there's one that he really likes. And I think those crowds walk away thinking, maybe with more of a sense that somebody in charge told them it's okay. It's okay to shut down, to take away liable law protections, things like that. And I'm not convinced that everybody has the sophistication to understand that when those things are gone, that they're going to be very, very hard to get back. So I'm really concerned to see a guy who's got the Republican nomination sewn up, voicing those things and being cheered for them. And I'm delighted with every Republican I see finally step forward and say, this can't happen.
You get the last word, Jackie.
Well, again, I really want to thank you for this forum and for the opportunity of this film, and it's fantastic. You know, being behind a microphone for so much of one's career, there's nothing that substitutes for getting to sit in front of an audience and take questions from real people with faces and names, and, you know, it's just great. I really love live events like this one. I'm terrified when he talks about going after the media. I happen to be married to someone from the Washington Post. I also saw a bumper sticker not that long ago, a year or two ago, that basically said there's one place you can always count on for lies, and that's the media. I think if we, and I'm a native Wisconsinite, so when I watch the capitulation by someone like Rance Priebus or Paul Ryan or Ron Johnson, who is a senator who called for closing the borders over Ebola, and I think, who are these people? These are my fellow Badgers, and do they really believe this utter contempt for how learning works? You know, I grew up listening to shows come out of Madison about how important it was to write a good sentence and to think carefully, and that we now have a very siloed media environment where someone can listen to Rush Limbaugh and others. It makes me worry about the future of our democracy. If we don't think that it's important to question authority or to have fact-based learning, then it really does lead you into a what is it all coming to kind of moment. And I think it's...
And do you feel that way as a journalist or as an American?
I feel that way, I think I'm both. I feel that way more as an American than I do as a journalist. Because as a journalist, I feel like, well, I can work my old channels and do my thing and be accurate. But if it's not reaching, and I see this in my own family, at home, in my state, if it's not reaching the people that I think should be persuaded, then what would be more effective? Then what? You know, and so maybe we have to come up with new models for the way we tell stories, which is why I told the head of the Authors Guild, get yourself some celebrities out there, you know? I mean, maybe you have to think outside the box. The ways we've been doing things haven't been enough.
Thank you. I just want to thank all of you. We're all in your debt for the work that you've done, and you know, you are among the most widely admired and revered journalists that we have, and we're just deeply grateful that you'd come and share with us your insights today, and for all you've done on the issues that we've been touching on today. So please join me in thanking our speakers.